Thank you for watching today. Today we're talking about Medicare and everything you've ever wanted to know about Medicare. Stay tuned. We are so excited to bring to you a whole program dedicated to Medicare. There are 101 things that people want to know about Medicare. And today we have two individuals who work in this field who can answer and respond to all sorts of concerns and issues regarding Medicare. Hello, Tricia, and hello, Teresa. Glad to have you with us.
Thanks for
Hello.
having me.
So let's just start before, because you all are the experts, right? So in order to be an expert, you've got to have a few qualifications. So tell us a little bit about your background and how you got connected and involved with Medicare. Tricia, do you want to go first?
Sure. So, by trade, I'm a certified health education specialist. Educating individuals and communities about health related things is sort of my passion. And I've
Mhm.
been at AARP for over 10 years. And the whole time I've been here, we've been educating on health coverage related topics, including Medicare. And then we've also done some education around caregiving too, because I know caregivers have a hard time sometimes navigating the beast of Medicare.
So you've been at this for a while. You've heard all the questions and concerns. So we look forward to hearing from you as well. Teresa, tell us how you got involved with Medicare.
I got involved with Medicare initially through volunteering. I began volunteering because I saw an ad in the newspaper, and since I was a caregiver for my mother, I realized how difficult it was to go through that maze of Medicare, and that's when. And I started that about 8, 9 years ago.
Well, so that firsthand experience is so valuable, and it just helps you navigate other people's questions and answers to where they need to go to get the kind of response they want. First, let's get a definition. People get Medicare, Medicaid mixed up sometime. What is Medicare and who is eligible for Medicare? Let's start there.
I'm happy to hop in. So, Medicare is the government run insurance program that covers people over the age 65, and then some people with disabilities who are under the age 65. For example, if they have a condition like end stage renal disease or ALS, Medicare has coverage for those folks. But for the most part, it covers people who are age 65 and over.
And is it income based?
It is not income based, unlike Medicaid, which
Mhm.
you referenced. Medicaid is your state based programs for coverage, and you have to sort of be below certain income requirements in order to get Medicaid coverage. Sometimes there are people who are going to be dually eligible and will have both Medicaid and Medicare coverage. But you really have to kind of look at your state and your own situation to see sort of if you qualify for that type of things. But Medicare also has other types of programs that can be income based, certain savings programs, things like that. But in general, no, it's not income based. It is individual coverage though. It's not family based coverage. So you don't get Medicare if your spouse qualifies for it. It's totally based on your own individual situation.
And this is the season for open enrollment. You can't just enroll in Medicare anytime that you get ready, correct?
Yes, that is correct. You can enroll in Medicare 3 months. There is an initial enrollment period. It begins 3 months before you turn 65. Ideally, you should go ahead and do that through Social Security. Also, as Trish mentioned before, if you're on disability through Social Security, you're automatically going to receive your Medicare card in the mail on the 25th month of your disability status.
The 25th day of your,
No, after you're on, if you're on disability for 24 months,
oh, I see.
then
Okay.
on the 25th month, you would receive your Medicare status. Also, if you are drawing Social Security at the age of 65, you will receive your Medicare card automatically in the mail.
And so people don't have to apply for it if they are turning 65, they're going to automatically receive their card. What if they're still working?
They would not, if they're still working, probably are not drawing Social Security. Then, if they have full benefits, working full time, receiving credible coverage, they do not have to enroll in Medicare. They would if they are working 32, 38 hours and do not have benefits, then yes, they will be required to enroll in Medicare. Otherwise, they could have a penalty.
I'll also jump in there and add that if you're currently continuing to work past the age of 65 and you have your employer-based coverage, the employer size actually matters as well. So if you work for a smaller business that has 20 or less employees and you have employer coverage, you will likely be required to join Medicare, enroll for the first time, and Medicare will become your primary coverage. And if they provide the job-based coverage still after Medicare pays primary, you may be able to have your job-based coverage as secondary. But that's an important distinction, I think, to keep in mind about whether you're working past age 65, whether or not you have to enroll in Medicare or not. It does get confusing, but thanks, Teresa, for talking about sort of the initial enrollment period and what people do when they first turn 65, which I do want to say is a distinction from the open enrollment period, which is the fall season. That's from October 15th through December 7th. Open enrollment is for people who already have Medicare coverage. And that's your opportunity to review your plan. We strongly encourage everyone who has Medicare to review your plan every year, even if you're completely satisfied with it already. It doesn't hurt to kind of shop around and take a look. Maybe your drug needs have changed, maybe your health or lifestyle have changed. It's always good to just set a calendar day every year and open enrollment. That fall period is for that. And that is different from your initial enrollment period, which is sort of this rolling 7-month window based on your birthday month.
And
Yes.
that's an excellent distinction because people automatically, as you said, Teresa, get enrolled when they are 65, but you want to review that every year because there are options for people, and whether, like you said, prescription drugs or whatever else they might need. So what's that open enrollment period again? The open enrollment period for people to look at that.
Yeah, so the Medicare open enrollment period is an annual period beginning October 15th and ends December 7th. And it is primarily for you, it gives you the opportunity to enroll in a Part D, which is a prescription drug plan, and or also to review your plan because maybe you already have a Part D, maybe you'll have your prescription drug plan, but you want to look at it because perhaps you got a new prescription drug that is not covered currently with your plan. That's the only opportunity for you to change that plan. You can make changes, you can drop that plan altogether and pick something. You can go to a Medicare Advantage plan at that point as well. You have to have at least a Medicare Part A. You don't have to have Part A and B, but you definitely have to have at least Part A in order to enroll in a Part D.
And that's what gets confusing for folks. And I know the AAA Area Agency on Aging, they help people navigate through that. So you can always call your Area Agency on Aging, and we can put some numbers on the screen for people to look at the website and to call. And also AARP has a wonderful tool to help you get. You can see it on the screen right now. Help you navigate through your whole Medicare path and trajectory. So if you want that big picture of Medicare, there it is on the screen right now. Take a look at that, and you can also go online and look at that. But let's talk a little bit about how people A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. Let's talk about what the differences are between A, B, C, D, Medicare. What do people need to know?
I can hop in there. So Medicare quickly becomes a bit of an alphabet soup, as you know. And, AARP is here to help you put those pieces together, which is why we try to create these educational informational resources that help you digest, because it can get pretty overwhelming pretty quickly. But I'll break down the major parts of Medicare coverage. Part A, which Teresa mentioned, is hospital coverage. And Part B is going to be your medical coverage, also things like laboratory services, doctor's visits. That's all going to fall under Part B. Then I'm going to skip Part C, and that's going to be purposeful, but I'll go over to Part D, which is drug coverage. I think that one's the easiest for me to remember because I remember D for prescription drug coverage. And those three components make up original Medicare. What we call as one pathway to get your Medicare coverage is by enrolling in original Medicare, Part A, B, and D. It's kind of like a little bit of a la carte, if you will. And then I skipped Part C because Part C is a whole other pathway, a whole other option for getting your Medicare coverage. And it is called Medicare Advantage. And it's kind of like an HMO based way of getting your coverage. Sort of you can get your hospital, your medical, and most will have drug coverage all under one umbrella. And so there's pros and cons to whether you go with original or whether you go with Medicare Advantage. It's very individually based, but Part C truly isn't kind of a subpart of original Medicare. It's its own sort of pathway for you getting your coverage, and you just have to make your choices. Part C, Medicare Advantage, has the convenience of having everything usually all under one umbrella, but then you might have limitations in terms of geography or the network of providers that you have access to. So those are things that you have to look at. Part, original Medicare, you have some choices. You have some shopping around. Most doctors accept Medicare. Original Medicare, you just need to sort of call and see if you're switching doctors, if they accept new patients, if you're a new patient, and if they accept original Medicare. So that's a sort of major decision that you have to make when you're first initially enrolling in Medicare, and even during the open enrollment period. You can switch between those pathways. You can go with original Medicare, switch to a Medicare Advantage plan, or vice versa. So when you first enroll, you're not locked in. You do have this fall annual enrollment period where you can make those changes.
And that's what gets overwhelming, right, Teresa? Thank you. That's what gets a little bit overwhelming for folks. How do I know what to switch to? How do I make a choice between this plan or that plan or this HMO? And then you're getting people calling you all the time, trying to sell you Medicare Advantage or there's something. How do people, if they have questions, how do people make that choice? I mean, I know it's individual, but give them some guidance of what they need to do in order to make an intelligent decision.
I always, people who come to me looking at Medicare, I'll ask them if they like to visit different states, if they're travelers and vacation or visit their friends or family members that live in a different state. More than likely, they want to stay under original Medicare. Or look at a Medicare Advantage that is in and out of network as well. Usually, original Medicare, because almost every doctor and hospital will accept Medicare A and B, and your prescription drug plan, which is the Part D, will generally speaking accept you in any state as long as the only difference might be the prescription, the pharmacy that you visit. So, for example, if you normally have a preferred pharmacy with CVS, and then you go visit your family in Florida and they only have Walmart there, it may be a standard cost for you rather than the preferred pharmacy cost that would be otherwise. As far as a Medicare Advantage, you have to be careful with those because they are in and out of network and they could cost you a lot more or may not even cover you if you're out of state. So it is important for you it is a very individual personal choice when you're looking at all those plans. So I always say, think about it, talk to family members if possible. It is something to consider. And I think that's why you're given time to do all of that review.
And so if people need help, I know we have a website and we have some other tools. Is there a place or somewhere they can call to just ask a question? Yes.
Yes. Well, in the state of Michigan, there's an 800 number, which is very common. You can even find it in your Medicare and You book of 2022 or 2023 that's recently out. Or you can go to any of your area agency on aging, which is divided by the regions according to counties. And they will refer you to, if there's a specific county that you live in that you prefer, you don't want to go way out of your way to go to that particular agency, they will give you a good number to reach that person or that agency. right now, Region 2, which I'm from Region 2, which is Jackson, Illinois, and Hillsdale counties. If you can't visit us directly in Brooklyn, where we're located at, by all means, you just give us a call directly.
Great. And that number again, we'll put it on the screen for everybody too, if they, that 1-800 number for people to be able to access. The other the other tool is the AARP website as well. Tricia, you want to talk a little about the great information on that website?
Sure. AARP has a plethora of resources. I'll also add to the list of phone numbers as well. You can speak to an AARP representative and ask questions about Medicare. It's a toll-free number, 1-877-634-8213, and live agents are available Monday through Friday for those who like to, prefer the phone. But then we do have these wonderful web-based tools and resources. We have the Medicare Enrollment Guide that's available at aarp.org/Medicare enrollment. That is a very easy to use, it's a self-guided, step-by-step tool where you kind of input some information about where you are and your lifestyle, sort of what your situation is, and then you'll get sort of a customized report, customized information based on your situation to help you guide through your Medicare decision making. And so, again, that tool is really easy to use. It's aarp.org/Medicare enrollment.
That's excellent information for people to have. And again, those numbers will be on our at the bottom of the screen at the end of the program for people to call, whether it's the AAA or whether it's AARP. And it's always nice if you can talk to a person and not have to keep pushing buttons and going from place to place. Then there's that great big picture for Medicare too that AARP has that helps the people navigate through exactly what they need to know and exactly what they need to do. Medicare is something that people have earned, the right to have Medicare. So it's regardless of who you are, if you're 65 years and older, you need to pay attention to exactly where you are in terms of Medicare and what your needs are and what you should be looking at, whether it's A, B, C is a little bit different, and then in Part D as well. There has been some tremendous progress with prescription drugs for individuals on Medicare under Part D. You want to talk a little bit about the Inflation Reduction Act and what that means for prescription drug people who are getting prescription drugs on Medicare for something like insulin. Tricia, can you talk about that?
I'm not as up to date on everything related to the act. Our advocacy team, as you know, does a large amount of work on that, and of course, our wonderful state offices such as yourself. I'll encourage everyone to go to aarp.org/Medicare for more information. But we have been making some great strides.
Well, I appreciate that. Yeah, there's been just such a major, massive effort from our volunteers and members throughout the country to lower the price of prescription drugs. And just this past week, which is why it's so new, that act, the Inflation Reduction Act, the ceremonial act was signed. It was signed the next day. It was signed that caps the price of insulin for people. It continued to rise year after year after year after year, but there was no change in terms of insulin and the research. It's the same insulin, 15 years ago today, but the price continued to rise. So that is capped for people who are on Medicare, as well as some of their other out-of-pocket costs for prescription drugs, which is really phenomenal news and gives people another incentive to go in, look at Medicare, look at exactly what your plan does and doesn't allow, and call someone if you have questions. It can be quite challenging to navigate. Would you not agree?
Yes, and I would also add that if you are limited in your income, there are Medicare savings programs that you can ask about as well. There's two separate applications. One is the extra help for specifically for your prescription drug plan. And the state of Michigan also allows for your Part B to be paid for as long as you are eligible and qualified for it by income and in assets as well.
So the cost can be, if cost is a factor, that can be mitigated to some degree. We've got about a minute left. Any last minute comments from either of you? And thank you so much. This is such useful information. Last minute comments or suggestions for folks?
I would just encourage everybody who has Medicare, who wants Medicare, to please contact your area agency on aging or AARP and get that information that you need. Get those questions written down so that when you come to visit us or call us, you have all your questions at hand. So we will be right there to answer them for you.
Thank you. Tricia?
That's such a good point, Teresa. You're not alone. You have help. We're here to help you digest and kind of navigate all of the confusion that sometimes Medicare can be, and it's constantly changing. So turn to the resources. AARP.org/Medicare enrollment is one great one. And, just make sure to get to know your coverage. And if it doesn't meet your needs, you can always change.
Thank you, Tricia San Diego and Teresa Smith. Thank you so much for being with us today. We appreciate both of you. And
You're
if you
welcome.
have any questions at all, there are some numbers and referencing material on the website. Thank you. And thanks for watching AARP Real Possibilities.
We are so happy you are here with us today. There's so much information you have, and we want to know, one of the first questions that people have is, how do you find an advisor?
That's a great question. And in general, we like to focus on answering the 3 F's, which is, the first one is fit. When looking for an advisor, you generally want to make sure that you and the financial advisor have the right fit from the very beginning. So communication is going to be one of the key pillars to building a relationship. Also trust. You have to ask yourself the question, can I trust this advisor? Can I trust them to do what's best on my behalf and on my family's behalf? And then also you want to see, is there experience behind this individual, behind the advisor, and what type of credentials they have as well. So the second F on that we like to focus on is whether or not the advisor is a fiduciary. And that's a term that gets tossed out a lot in the industry, but generally what it means is that there is an obligation and a responsibility that advisor has to do what's best on your behalf. And lastly, is there foresight? So is there, what is the investment strategy that the advisor has, and what is the train of thought that advisor goes, the decision-making process that is involved in dealing with your money?
Fit, fiduciary, and foresight. That's powerful. That's really powerful. So when someone's looking for an advisor, are there credentials that they need to make certain the advisor has also?
Absolutely. And I would say there are a couple of credentials that are out there. The CFP is one that everyone recognizes also.
And it stands for?
The Certified Financial Planner.
Yes.
Right. And there's also other designations along with that, but in general, you also want to look at the experience that advisor comes to the table with. So how many downturns have they gone through? What has been their thought process behind that as well.
Tell us why people need an advisor.
In this day and age, one thing is true is that money is involved in all aspects of our life.
Yes.
Right?
Or not.
That's very true. And what we think is that an advisor really adds a component to an individual's life that can help navigate the downturns, the upturns, and can help really extend and expand upon a person's wealth, and not just their financial wealth, but also their well-being wealth. So.
And it's a certain kind of mental relief or relaxation. You don't have to do this alone, right? We don't want anyone to have to struggle through this alone and make mistakes. So that's why they have experts. That's why they have people you can call. And so what's the first thing that someone should do to look for advice? Where do they go? How do they ask a friend, a neighbor? How do they find an advisor?
Well, yeah, we still believe that, finding an advisor is a lot of word of mouth, but there's also a couple of really good websites. The Chartered Financial Planning and the Certified Financial Planning websites both have a good number of just filters where you can look for advisors if you're just doing a broad scope. But then lastly, AARP is a great site to go to.
Thank you so much. We appreciate you being here. It's excellent advice. Thank you.
Welcome.
Dr. June, I am a proud grandmother. There are a lot of grandmothers who watch this show and mothers and fathers who watch this show. And people have medicines around. What do we need to know in order to protect our grandchildren and or our children from the medicines that we might have around our house?
Well, as you know, most pharmacies now use the protective caps or child-proof caps, but as we move forward, we're starting to get the tear open cases and stuff that's much easier. And not all medicines are tear open, or not all medicines have the child protections on them. However, we're finding out that even adolescent children or your teenage children, grandchildren, and what have you, are getting into the medicine cabinet. just out of curiosity or, on accident. But it's kind of our responsibility and grandparents and anyone who's owns a medicine's responsibility to make sure that your medications are secured and protected. Our narcotic or addictive medications that are dangerous should really be put into a lockbox. And that way it's not easily accessible to anyone but yourself. And that's the responsible thing to do for the protection of your children or grandchildren.
And that lockbox should be put somewhere where they can't have access to it, or is there a conversation that needs to take place with the children? Because for some older adults in particular, I mean, just even getting into a lockbox itself and then getting the medicine out could create some concern.
And that's right. You have to also have a chat with your children, or grandchildren, and whoever you think it's appropriate to at the right age, is to let them know to respect this, like they would if you had a gun in your house or something like that. You have to let the children know to respect this, and this is what this is, to stay away from this, except for if you want permission or need to discuss it. That way that they've also been talked to, and you educate them on this too. And that can do wonders more than any lockbox could do, but the lockbox keeps honest people honest.
Absolutely. And you should always make certain that you know exactly where your medicines are and keep them out of the reach of anybody, just even prying eyes that might come into your home. So thank you. Appreciate that information, and hopefully those of you who are listening, news that you can use. Thank you. Amy, thank you for being with us again. We're going to continue our conversation about our care once we've had some kind of hospital stay, nursing home stay, and people are going home. What options are available? Does insurance pay for those options? What do people need to think about post any kind of healthcare situation?
Yes, absolutely. Like I said, Medicare is going to cover anything that has to do with your health or rehab up to a point. But what you need to think about when you're thinking about going home is who's going to care for you once you're home. I mean, because a lot of times when you come out of rehab, you're not exactly tip-top shape. So you're going to need a little bit of extra help. What the insurance companies don't cover are things that you do with your activities of daily living. So like toileting, transferring out of bed to your wheelchair or walker, bathing, dressing, eating, all of those things are not covered under your insurance. So that's going to be something that's going to be an out-of-pocket expense. If you are planning on your family taking care of you once you get back home, you might want to make sure that they are aware of that, because there's a lot of people that they don't want to talk about it. And these conversations need to happen. You have to have the conversation, say, look, I am coming home. I am going to need this, 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 and this. And if your family is not down for that, you need to kind of make sure that you've got somewhere that somebody's going to come in and be able to help you. So
and that's so important. I mean, we need to make certain that we plan ahead in order to have a successful post-care experience as well. Correct? I mean, that's
absolutely.
It doesn't have to be a family. It could be your trusted friend or someone that you know and trust completely. Thank you, Amy. That's excellent information.
You're welcome.
We've shared so much information with you today. Hopefully there is news that you can use. Thank you for watching Real Possibilities.